excited to present tonight and very happy to have you here. I'd like to welcome you. My name is Gina DeLuca, and I'm a registered dietitian with PCC Huntington, and I cover all diagnoses for patients at this point in time.
So my name is Rebecca Hirsch. I'm also a registered dietitian. I work at the 34th Street location for PCC, and I work with all of the breast cancer patients. Again, Gina and I are very excited to be here with you tonight. So just a few points that we we want to make. No disclosures to reveal tonight, but something else that we really want to emphasize is though most of the available research that we are speaking about is centered around women's breast cancer, we don't lose sight of the fact that about 1 out of every 100 breast cancers diagnosed in the United States is found in a man. So it's our hope that all information presented tonight is useful to everyone.
So our objectives for tonight include to learn why balanced whole food nutrition is your ally in breast health, learning which foods pack a powerful nutritional punch so that it's practical for you, and discussing these practical ways to incorporate these foods and other healthful lifestyle behaviors into your regular daily life.
A cancer survivor is a term that is used for anyone that has been diagnosed no matter where they are in the course of their disease. It is often defined by 3 phases. The definition of these 3 phases does sometimes vary slightly, but to give you a breakdown, phase 1 starts with diagnosis and ends when treatment is completed. Phase 2 may include the months after treatment when someone has achieved remission or is with stable disease. Phase 3 may apply to people who are cancer-free for a period of time or ones with advanced cancer with the goal of end-of-life care. While a person's needs will likely change through all phases, it is important to recognize the value of nutrition to help with each of them. In other words, maintaining a good diet is essential with things like symptom management, maintaining quality of life, and risk reduction.
The American Cancer Society put out the guideline on diet and activity for cancer survivors. It was updated in 2022. And we like to present this because this gives the general overview and the framework as general recommendations for cancer survivors. So what's very much encouraged is that nutritional assessment and counseling should begin as soon as possible after diagnosis, whenever possible, with the goal of preventing or resolving nutritional deficiencies, preserving muscle tissue, which helps to strengthen the immune system and the overall quality of life, and also to manage side effects of treatment, which may adversely affect nutritional status. Physical activity assessment and counseling should also begin as soon as possible after diagnoses. And this really helps to, again, gear up in terms of the physical aspect, providing muscle support, and helping patients to tolerate treatment as best as possible. Typically, there are better outcomes when physical activity is involved as medically feasible. So we like to encourage that overall. And what we'll see throughout is that there's a continuum of prevention, treatment, and survivorship. And sometimes there's some overlaps. So some of this information is going to overlap, but really overall it's to encourage general health to really help support our patients and just people in general as best as possible. So the Cancer Survivorship Guideline on Nutrition and Physical Activity for Cancer Prevention is sort of the concrete template of what's encouraged. So achieving and maintaining a healthy body weight throughout life and trying to keep that body weight within the healthy range and avoiding weight gain in adult life. Being physically active. These are recommendations that come into play for moderate and physical activity, and we'll get into this a little bit more in later slides. And we really just want to encourage people to move more and sit less. That's the bottom line. Everyone is where they're at individually. We don't want people pushing past the point that's tolerable or appropriate, but to just have activity be a part of the daily life is encouraged. And then following a healthy eating pattern goes right in line with this. So mainly plant-based foods, foods that have a lot of nutrition, especially vegetables and fruits that have a lot of color, phytochemicals or those plant compounds, which we'll also get into in a later slide, but really foods that are whole, that support health with natural nutrients. And then limiting foods, including red and processed meats, sugar-sweetened beverages, and especially highly processed foods and refined grain products. And then it's also best not to drink alcohol. We will get into that in a later slide as well, but just really encouraging an overall healthful pattern is key.
And just tying into what Gina says, empowerment is a huge part of this, and following these guidelines definitely can be a great tool to feel empowered, because following diagnosis, through treatment, and even after treatment has completed, it's not uncommon for one to feel that they've kind of lost control a little bit. However, with nutrition, for the most part, the ball really remains in our court. It's our hope that people feel empowered by this and see that the foods that they choose, as well as their general lifestyle patterns, really do go a long way. For over 25 years, two organizations, World Cancer Research Fund International and the American Institute for Cancer Research, have examined the relationship between diet, weight, physical activity, and their link to cancer. They have put forth something, the Continuous Update Project, created and managed by a panel of experts who regularly review and update research and recommendations for cancer prevention and survival. With the most recent research, what they have reinforced is our defined controllable risk factors for breast cancer, which are the importance of maintaining a healthy weight. It has been shown that adult weight gain and excess body fat increases the risk for most types of postmenopausal breast cancer. We know that consuming alcohol increases risk in both the pre and post menopausal population. And finally, physical activity has continuously been shown to decrease risk for both. With breast cancer, even though there may be some variability depending on age or type of disease, we can't lose sight of the fact that there are many other types of cancer out there. Overweight obesity has been shown to increase the risk for 12 additional types of cancer. Alcohol increases the risk of an additional 6. And research has shown that exercise can lower a person's risk for 13 types of cancer, breast cancer included, by some of upwards of 20%. So if anything, in other words, maintaining that healthy lifestyle is key to helping to reduce cancer risk on a large scale.
So we find that two heads are better than one, and a peer collaboration for patient diagnoses resulted. As I have covered breast patients for some time as well, Rebecca and I have always collaborated in terms of, the questions that we get asked by patients and how do we stay on the cutting edge of the information that we can offer. So because of that, we were actually also asked by physician care teams for a written resource to be developed. So we started to kind of brainstorm about this, and what's going to come next is the result that followed, and we found that it's been very effective for the patients that we've offered it to so far, as well as the teams that we work with. So we hope that basically what you're going to see in the rest of the presentation is what has come out of that as the framework. So we hope that you'll benefit from it as well.
Yeah, so this is just the handout that Gina was speaking of. We created it together with the general questions, as she mentioned, that we get regarding breast cancer and nutrition. It provides great answers, to some of these questions and some of our current recommendations. It can be found on the hospital intranet or by asking your medical team for a copy, because Gina and I always reinforce all questions are great questions. So hopefully this is a good, first foot forward for some of those. Next slide. Just to review some of the topics that we are going to review tonight, we'll be going over healthy diet, foods to avoid, and including your regular menu, dairy, soy, flaxseed, phytochemicals, the new American plate, alcohol intake, physical activity, intermittent fasting, processed foods, hydration, mindful eating, and some great resources that you can always refer to.
So I happen to love this slide because it was basically the study from the American Journal of Clinical Nutrition that our handout came from, mainly. So again, nutrition assessment immediately after diagnosis. We want to get in there as soon as possible to help intervene and help our patients. So preserving lean body mass is the main goal. So again, keeping the muscles strong, avoiding an increase in fat mass to go along with that and help reduce risk further. Personalized nutrition intervention based on dietary habits, schedule, someone's daily schedule, and how can they make this happen, activities that they prefer, cultural food preferences, and daily energy intake distribution was basically said to be less than 30% fat. So we want to focus mainly on the monounsaturated and polyunsaturated fats, and these are the fats found in plants as opposed to saturated fat found in animal products. 55% whole food carbohydrates, grains, fruits, and then about 1.2 to 1.5 grams of protein per kilogram per day. So basically about 20% of the diet pattern would be protein. I think sometimes there's let's say a hyper focus on protein in our society, but the truth is we really need the fiber, we need carbohydrates for energy as an energy source, and we just want to balance things overall. And we can get pretty high quality protein from plant foods if it's, again, eaten in a diet pattern, a pattern over time that helps offer all these different nutrients. So variety really is key. And then fruit and vegetable daily servings, 5 to 9 per day, were identified in this study. So again, most people may not get that many. We want to encourage this and encourage all the different colors. food-based sources of the vitamins and minerals listed here. So again, we're not relying on supplements as much as we are whole foods or just whole foods in general. So we want to, we'll cover that in a later slide too, but we want to really emphasize how important these components are, especially cruciferous vegetables. This is a really powerful family of vegetables when it comes to breast health. So the equivalent of about 1 cup or 8 ounces daily, including garlic, if you're able to digestively tolerate that in the mix, helps absorb the phytochemicals that are in the cruciferous vegetables. So they have a very, protective effect against cancer, especially for breast health. So what does the healthy eating pattern look like? The foods to include. So again, fruits, vegetables, especially the cruciferous vegetables. And here's some actual examples. There are plenty more. So I, tend to encourage people, if you don't like one, don't turn your back on the whole family. There's a lot there to choose from. Again, including the garlic helps for an extra protective effect. Lean and plant protein. So some people prefer animal protein, especially if they are going through treatment. So, we just want to encourage, again, as much variety as possible, but also leaning on our beans, peas, lentils, legumes to help. Low-fat dairy, organic when possible. So some different dairy sources, and we'll also explore dairy in a bit as well. And whole grain and root starches. So we want to look for, again, really high fiber, healthy whole grains that offer so many benefits. And then even our winter squashes that offer these colors and different vitamins and minerals. And then healthy fats in addition. So nut seeds, avocados, plant-based oils instead of, highly saturated fat or hydrogenated oils that include trans fats that can turn to a saturated fat in the body. Coconut where possible, it sort of has a nice balance of fats in the profile. So all these things, again, in the diet pattern over time help to even out and help so much. And foods to avoid. So on the flip side, we're not saying never have these things at all if you must, but really the majority of time, I like to call it the lifestyle factor. We want at least, I would say 75 to 90% of the time, trying to eat as clean as you can from the healthful foods and trying to avoid these foods. But again, including them if there's a special occasion, we want to help people be, in touch with what they're having, live a sustainable process. And, but the processed meats really are such a big offender for not only breast health and breast cancer, but for many other types of cancers as well. Also excessive red meat from non-organic sources due to hormones and antibiotics and just other practices. These things, these meats can have components that can be harmful over time. And the refined foods, a lot of patients I'm finding lately are reporting just, not feeling well after eating refined and processed food. And it really is connected to the inflammation that these foods can cause. So we want to really try to limit that. And then high fat dairy products as well. If you're drinking and eating a lot of those foods over time, that can also contribute to increased risk. So we want to make sure to try to avoid.
Whether or not dairy products will affect breast cancer, I think is a question that we get very often. A major concern always being whether or not trace hormones or other compounds have the ability to increase risk or lead to recurrence. And though some research may be suggestive, to date, no definitive link has been established between the two. In 2015, a pooled analysis of 22 prospective studies consisting of over 1.5 million participants found either no link with dairy and breast cancer, or that dairy may have the potential of benefit of risk reduction. Now, something I've been asked about a number of times is a more recent study that came out in 2020, which did raise some concern. It was published in the International Journal of Epidemiology and looked at dairy, soy, and their potential connection to breast cancer. To give a quick breakdown, the study included a large population of almost 53,000 participants. At the beginning, participants were asked about their diet, including dairy and soy, as well as other lifestyle patterns and potential risk factors. Upon follow-up, I think it was 8 years later, it was shown that over 1,000 participants had been diagnosed with breast cancer. Consuming as little as a quarter of a cup to 1/3 of a cup of dairy milk per day was linked to increased risk. To note, no link was established with the consumption of soy, cheese, or yogurt. So understandably, this of course raises a red flag. However, we can't lose sight of the fact that with a study of this, such a large scale, there were of course limitations. First, this was an observational study, and observational studies only provide suggestive results. In other words, absolute risk and cause and effect cannot be established. Another thing to consider, all participants of this study were Seventh-day Adventists who generally follow a plant-based diet, avoiding most animal products, alcohol, and caffeine. However, certain people among the population do choose to incorporate more dairy into their menu. With potential varying amounts of dairy consumed by participants, this leaves the question of whether this could have skewed results. Also, something to consider, because of the noted dietary restrictions, can the results be applicable to the general population? And finally, over the years that the study took place, did participants' eating patterns change in a way which may have had some type of influence? In other words, no definitive link can be established or has been established. Just to add, circling back to the continuous update project, with available data used with the most recent publication, possible risk reduction and with dairy and breast cancer was found with the premenopausal population. In the postmenopausal population, data was too limited and no conclusion was made. So I guess I think the takeaway really is, with the research that we have, no link is really concrete and more research is needed. So as we know, bone density declines with age, which is why it is so critical that we all do whatever we can to avoid issue. In addition to age and relative to breast cancer, what is important to remember with certain medications like aromatase inhibitors, Femara, Arimidex, Aromasin, these are linked to higher risk of osteopenia and osteoporosis. To help manage this, the dietary intake of certain nutrients like calcium is essential. Calcium is the nutrient in the front lines of keeping our bones strong. So dairy is, of course, our #1 source of dietary calcium, which is why it is important that a person consumes enough on a daily basis. So current recommendations for dairy is about 3 servings per day. To give you an idea, that's 1 serving equals 1 cup of low-fat milk, 1 cup of low-fat yogurt, or 1 ounce of low-fat cheese. Even though this is the recommendation, something that Gina and I always like to reinforce is that the most important thing is that you're comfortable with what you're eating. So if dairy is something that you prefer to limit, just make sure that you're getting calcium through other food sources, including canned salmon, sardines, leafy greens, almonds, seeds, fortified foods, edamame, broccoli, white cannellini beans, and also, you can always consult with your doctor to see if additional supplementation may be needed.
We get many questions on soy as well, and the impact of soy on breast cancer prevention and treatment does remain controversial. So one point that's really interesting and important to note is that phytoestrogens, which are plant estrogens, are not the same as our body's human estrogen. And some studies have found a decrease in breast cancer recurrence in people who regularly consume soy-based foods, though other studies do show the opposite. So the National Institute of Health, the NIH, states that current evidence indicates that it's safe for women who have had breast cancer or who are at risk for breast cancer to eat soy foods. However, it is uncertain if soy supplements are safe for these women, and for men. So basically here, what we want to look at is the protective effect of the phytochemicals, which are the plant compounds in the whole food packages. So these are, just amazing little compounds that have been identified to do so many powerful functions, especially protective for cancer. So what we encourage patients to do is to strive to eat mainly unprocessed and whole food sources. So your tofu, tempeh, edamame, soy nuts, even natto, which is a fermented soybean delicacy. We learned about that when we created this handout, soy milk. These are the foods that you want to focus on. And if you can choose non-GMO and organic, even better. It's more your processed soy products. So things like soy yogurts, cheeses, and the plant-based meat alternatives, you may want to have in moderation. I think it's all relative for, if it's that you're avoiding red meat, but trying something like this instead, that may be a consideration. But we really encourage people to avoid all soy supplements. So powders, pills, a lot of the bars and things that have really high concentrations of soy protein isolate, those are the things that are considered to be almost like a wild card. We don't know how they're going to react in the body, the same way that we can, feasibly predict whole food sources. So we hope that helps to give a comprehensive overview of soy.
Now, flax is another question we get a lot. I definitely get a lot of questions about flax, and it's a crop which is a source of many nutrients, including fiber, alpha-linoleic acid, a type of omega-3, and a variety of micronutrients, including magnesium, phosphorus, copper, and thiamine. However, I think the phytonutrient that really gets called into question are the present lignans. Now, lignans are phytoestrogens. To say again, this is not the same as your body's estrogen. Similar to the question with soy concern is whether or not this has any effect on breast cancer. And though research is again somewhat limited, what has been shown is that lignans may actually have real positive effect. The thought being that lignans may have the ability to change the metabolism of your body's estrogen, producing weaker forms, which may help to work against hormone-sensitive cancers. And it's, in a sense, acting almost like an anti-estrogen. Lignans are antioxidants and have anti-inflammatory effect, which can inhibit tumor growth by working against abnormal cells. And finally, lignans are a great source of fiber. I always like to make the joke, if I could change my middle name, it would be fiber. I do think it's the answer to most of our questions or problems. But as you know, it's essential in helping to reduce breast cancer risk by helping things with things like weight management. So to give some idea of the research out there, in a small scale study of newly diagnosed breast cancer patients, it was found that the daily intake of 25 grams of ground flaxseed, I think presented in muffins, led to significant reduction in cancer cell proliferation. In another study, consumption of flaxseed or flax bread on a weekly basis was associated with a 20% reduction, again, in the risk of breast cancer. So there is definitely potential. Current recommendations for flaxseed is to have this in moderation. Again, we're learning more and more about this, which this equates to about 2 to 3 tablespoons in total.
Phytochemicals, here we are. And I found that, I know this might be a little bit tough to read with the print being small, but I think you get the idea with the colors and the associations between, the different foods associated. So I love this. This was the best visual that we found, because it really shows that you want to eat the rainbow. You want to have a lot of different colors. It doesn't have to be every single color every day. Again, that's where the diet pattern over time comes in. But these foods are really powerful and protective, and we're never going to find supplements that are going to compare to this, because in supplements, when components are isolated, they don't have the same powerful effect. There's a synergy that happens between the phytochemicals and all the components in a whole food package that doesn't happen otherwise. And then the way that all the different colors, so all the different phytochemicals associated with all the different colors work together. It's a really, really powerful effect that way. So we sort of felt that, a picture spoke 1,000 words with this, and I hope that that conveys it. But this was really, powerful from a journal in cancer genetics, because, to have that illustrated so sort of clearly, I think that's pretty profound.
So the New American Plate, as the AICR, the American Institute for Cancer Research puts it, the keys to the New American Plate are portion and proportion. This design helping to put together meals that are filling, well balanced, and packed with real nutritional gain, while additionally reducing cancer risk. The goal is to have a wider variety of unprocessed plant foods. Vegetables, fruits, whole grains, beans, nuts, and seeds should make up about 2/3 of your plate. About 3 ounces or 1/3 of your plate or less should be covered by lean animal protein sources, fish, poultry, chicken, turkey, leaner cuts of meat. But don't forget in general to limit your consumption of red and processed meats. You can substitute an animal protein with a plant protein. And by doing this, you're making a meal that is even richer in cancer-fighting nutrients. You should enjoy what you eat. And I do think color helps people to really do that. This shouldn't be seen as a rigid diet, but as an opportunity to be more creative and flexible with your meals while regularly promoting your own health.
So to loop around and touch on the herbal and dietary supplement aspect. So again, a whole food plant-based way of eating really provides nutrients in package form, where you get all those different nutritional components that work together, and they work more effectively that way. And then consequently, they're effectively absorbed and utilized better than supplement form can be. Sometimes even taking isolated nutrients in the form of supplements can throw off the balance of other nutrients in the body. So that's why, as Rebecca mentioned before, we want to always touch base with the doctors to make sure that taking a supplement is appropriate in regard to your overall medical condition. Now, if somebody has a medically diagnosed clinical deficiency, which is often identified through blood work and maybe some other nutrition-focused physical exam findings or other exam findings by the doctor, then it would be appropriate depending. But for the most part, we don't just want to start taking things blindly. And so that's where the visual comes in. We really want to proceed with caution, have the conversation. We often, in our role will help be the liaison to help these conversations happen. Sometimes we find that patients are maybe a little bit nervous to talk to their practitioners about it, but it's a big topic that's out there. There's a lot of information online and on social media. People are often coming to us with these questions. So we like to really have these collaborative conversations that weigh each circumstance and each issue for the patient so that we're giving them the best care. But when in doubt, food first. So we really try to advocate for that.
So research has consistently shown that drinking alcoholic beverages increases risk for breast cancer, again, in the pre and postmenopausal population. And this is because it potentially increases the likelihood of weight gain, certain hormone levels like estrogen, and it could damage healthy cells in our body. It has been found that compared to women who don't drink at all, women who have 3 alcoholic beverages per week have a 15% higher risk of breast cancer. Experts estimate that the risk of breast cancer goes up another 10% with each additional drink. I think the easiest way of putting this is the less you drink, the lower your risk. If you do choose to have a drink, just remember to be mindful of how much. I think awareness is always the most important thing. So a drink is defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor.
So physical activity. So again, sort of bringing this back around and breaking it down into parts so that it's, sort of clear and manageable for what this actually would look like. So cardiovascular exercise, resistance exercise, and stretching exercise. I like to think of it like a triad and they work together. So cardiovascular exercise is important for increasing your heart rate, helping with heart health. So moderate intensity activity for at least 150 to 300 minutes per week is what's generally recommended. So if you think about starting on the lower end, maybe someone's just starting out, moderate intensity, the best way to describe it would be you can't sing, but you can still hold a conversation. So if we take that 150 minutes per week, maybe divide it down by 5 days, you've got 30 minutes a day, that may really be more manageable than we think. However, if you prefer more vigorous intensity activity, then it would be 75 minutes per week. And again, if you're starting out, breaking that down, it's 15 minutes per 5 days. You can also do a combination of moderate and vigorous intensity activity. So we really just want to encourage that because it really, really helps the heart and in conjunction helps, really strengthen heart health in conjunction with cancer prevention and cancer survivorship. Resistance exercise helps to strengthen major muscle groups. So 2 to 3 times weekly would be what's recommended. Some patients start out with physical therapy as guidance to really help. But these would be the major muscle groups. So it will depending, someone could maybe, do, maybe one of those things every day or, to kind of alternate it or do different groups of muscles depending. But stretching exercise is encouraged as well. So on at least 2 of the days of higher intensity activity, we want that going together because that really helps the muscles to be good. Medical clearance is important. So we want to make sure, again, that someone's medically cleared to be able to utilize these opportunities. And these are from the NCCN guidelines for patients for survivorship care. So again, bringing it down, moderate intensity versus vigorous intensity. And the METs are metabolic equivalent of task. So it's basically just the energy that's being put out. These are different examples, some concrete examples that are helpful. So, that kind of offers that too, because maybe you don't want to do a particular thing or the same thing, you want to mix it up. So these are lots of different suggestions.
So intermittent fasting is a dietary pattern which puts the body in fasting state by not eating for a period of time. So the focus is not so much on the types of foods you're eating, but instead when you choose to have them. In more recent years, there has been real buzz as to whether this may have an effect on breast cancer risk. And the answer is maybe, which is exciting because this then could be looked at as a more organic approach to help with things like risk and managing the effects of cancer and treatment. But the information that we have really is quite limited. And research is in early phases, with most studies to date being conducted on a smaller scale or in lab settings. However, just to give you an idea, with one study that looked at time-restricted eating, which is a form of intermittent fasting, researchers found that compared to women who fasted for 13 hours or more in evening hours and sleep hours, women that fasted less each night were 36% more likely to have their breast cancer recur. Women with the longer fasting times also had significantly lower hemoglobin A1C levels. Another small-scale study centered around the fasting mimicking diet, which follows significant calorie restriction, varied more with more regular eating patterns. Participants were found to have improved chemo-induced side effects, as well as reduced blood glucose and hormone levels. And finally, in a recent systematic review of available research, it was shown that there may be a potential benefit with regards to chemotherapy-induced toxicity. So, if anything, it sounds like there is real potential. But Gina and I both always like to emphasize safety first, and though that there may be real potential with this, it may not be for everyone, and that's okay. The takeaway is it does open an exciting new door, but the best diet is one that can always be sustained over time. Processed food continuum. So processed foods includes foods that have been cooked, canned, frozen, packaged, or nutritionally altered by fortifying, preserving, or preparing in different ways. While with some foods, this may be a good thing. Milk, juice are fortified with calcium or vitamin D. But a good goal always is to fill your plate with whole foods and avoid as much as you can that is processed. It's important to accept that sometimes the foods that you eat are going to be processed to some degree. This may be based on food availability or what your daily schedule allows. But meal planning always can be quite helpful. But to use this, it's always, again, just a good, good idea to have a good understanding with regards to where your food selection falls on this continuum. So to give a breakdown, here is a ranking of processed foods from minimally to most processed. At the top of the list, we have whole foods, which are any foods which are close to their natural form. Regular fruits, vegetables, and different types of whole grains. Next, we have minimally processed foods such as washed and packaged fruits and vegetables, roasted nuts, which are simply prepped for convenience. After that, there are foods which are processed for preservation at their peak to lock in nutritional quality and freshness. This may include canned or frozen fruits or vegetables. Next are foods with mixtures of combined ingredients, which may be added for flavor or food texture. Things like that fall under this category may be jarred sauces, salad dressings, different cake mixes. Following that, ready-to-eat foods such as crackers, chips, certain beverages, and deli meats, which are definitely more heavily processed. And finally, the most heavily processed foods are often foods of convenience, frozen or pre-made meals, including frozen pizzas and microwavable dinners. Being familiar with these categories, though, is definitely going to be helpful to help you make the healthiest food choices possible.
So UPF is ultra processed food, and unintentional weight gain is often something that results from consuming large amounts of ultra processed food. So data suggests that eliminating ultra processed food from the diet decreases energy intake and results in weight loss, whereas a diet with a large proportion of UPF actually increases energy intake and leads to weight gain. So even when matched calorie for calorie, this occurs. Oftentimes because calories provide energy, we think a higher calorie, intake is going to cause, but actually it can be just the same amount, and this happens. So it's a fine balance because we still need to consider the time, the skill, the expense, and the effort involved in meal preparation. Some people need to rely on these foods for convenience and cost and different factors. So we're always taking this into account, but it really presents a major concern because these foods are so readily available and they're more heavily processed than they were years ago. We have this quandary. So more mechanistic research is really urgently needed to identify the precise attributes of these foods that elicit harm, and also to optimize effective reformulation strategies to improve human health. So again, that continuum of processed food, maybe certain foods can be processed in certain ways that wouldn't be as harmful. But in the meantime, how does this information translate into application? So we want to utilize food information. Food is our information to find out how we're going to move forward. So diet quality is really what comes to the forefront here. And that's where that varied diet pattern of whole food comes in and really helps. So the main risk here is how does UPF translate into cancer risk? So this study was done, it was greater than 100,000 adult participants, and it showed that 10% increase in the proportion of ultra-processed foods in the diet was associated with a significant increase of greater than 10% risks of overall and specifically breast cancer. So, and these results remain statistically significant after adjustment for several markers of the nutritional quality of the diet. So after all those things were accounted for, this was still the result. And these are components of a Western diet pattern that are concerning. So again, it all comes together, to just keep encouraging whole food. Again, further studies really are needed to understand, again, the precise aspect, the dimensions that are involved, nutritional composition, certain food additives, just different contaminants and things that can occur. So it's really a complex situation, but maybe something where there's a simple answer at this point. Let's move back to whole food as much as possible in the meantime.
Hydration is essential for proper body function and a key part of just promoting overall health. I can be a pain about this, and I really like to tell people to remind themselves to drink enough every day. For different people, the amount of fluid required may vary a little bit, but I always like to go by the 8x8 rule. Aim to have 8 glasses of 8 fluid ounces of some type of decaffeinated beverage through the day. So, how you choose to present this does not necessarily have to be with 8 glasses. You can have 2 32 ounce bottles or 4 16-ounce bottles, or like I said, the 8x8. But the goal is always to, focus on fluids that are decaffeinated and avoid your sugary beverages. So focus on, water, sparkling water or seltzer, different types of herbal teas. I love infusing water with, different cucumber slices, different types of fruits and vegetables to give you some variety. The goal again is just to really try to, kind of get to the 64 fluid ounces by the end of the day. And whether it's beverage or not, having a soup, it definitely counts. If you're having a sugar-free popsicle flavor, natural flavored popsicle, that definitely counts. Making a smoothie, definitely all this goes towards to reaching the goal of 64 fluid ounces.
So we really love this approach of mindful eating because this really sort of brings it back to the center to say, how can we incorporate these whole foods and have this whole process around it? So pondering questions, it sort of lends a different dimension. What do we think about when we eat? Do we think that cultivating gratitude and appreciation might be helpful? And what might doing this offer to you, and how might we benefit from it? So when we bring these aspects of the sensory aspect of food, so again, whole food, how does it smell? What does it look like? How does it actually taste? And you can taste the difference in whole food, and oftentimes in organic foods and really, deep colored fruits and vegetables that have a strong taste. The community aspect of, maybe volunteering to donate food or to gather food, the spiritual aspect, whatever that means to each person, and really tuning into that and realizing that food really is the great connector between all of us.
I think, I like to sometimes say the most toxic thing is the internet. So I think when you're pulling your information, you definitely want to go to reliable resources. Usually websites with .org at the end are good places to go. Specific to breast cancer, traveling to American Cancer Society, American Institute for Cancer Research, which is definitely one of our favorite websites. National Cancer Institute, Susan Komen, breastcancer.org, really just provides a wealth of knowledge, information that's, current. It can give you really good direction as to how to make the healthiest food choices. Awesome. Okay.
All right, thank you. We will open up for questions. We already have a couple in our queue. Our first one is, what should I avoid since I'm estrogen positive and progesterone positive?
Well, I'll just say, I think hopefully the takeaway from our presentation is you don't necessarily need to avoid anything. I think, with regards to what we recommend with a plant-based diet is avoiding pro-inflammatory foods in general, which include refined carbs, added sugars, added salts, but specific to hormone levels. And circling back to our risk factors, the only thing I can say, kind of relative to that is excess body fat can produce estrogen. So there's not going to be a single food necessarily that has an impact. It's how all of your food choices come together by the end of the day. I don't know. So again, with regards to the question of phytoestrogens, hopefully we've made the point of it, though for some, some information leaves us with kind of in a gray area, but there's no definitive link between the two. And a lot of research actually has shown real potential positive effect.
I mean, again, I think it comes down to the balanced pattern. As far as all of these helpful foods, they have a naturally, let's say, a natural effect to decrease blood pressure naturally where possible. Maybe there are other ways to flavor, like herbs, fresh herbs and spices and things like that. But I probably would encourage, a varied diet pattern, and maybe considering speaking with the practitioner that someone sees for a condition to maybe connect them with a dietitian through that practitioner.
Yeah, I mean, I would also say, I would never encourage a high sodium diet, but something as, basic as having, chicken soup. Broth has some sodium in it. So I think you can do it kind of, at a level maybe which is less concerning than going, on a regular basis and having, a big bag of pretzels or something like that, which has, a lot more, maybe a bad example, but it has a lot more noticeable sodium. Canned foods have tons of sodium. So I think, kind of doing it at a moderate amount may be an approach to consider. So there's a lot of research that has shown a connection to increased risk for colorectal cancer. So the current recommendation for that is not exceeding 18 ounces per week. They say the American Institute for Cancer Research says limiting processed meat altogether. So, I mean, I would just be mindful, breast cancer aside, but, and things like cholesterol and saturated fat, we have to think of our cardiovascular health as well. So I think ideally, I mean, I personally like to tell people even going vegetarian 1 night a week. So I think, animal, protein is not a bad thing. You just always want to think of, exactly where it's coming from and what cut of meat you're getting, certain cuts being leaner than, others.
So I think I would say it depends maybe on the crop and what's involved. Do we absolutely need to purchase everything organic? I don't know. Again, a topic that I'm learning more and more about, the specifics and what's actually involved. It's definitely safer and, let's say, a higher quality organic wise if it's USDA organic. Again, as far as I know, are there, let's say, independent farms that might not be yet USDA certified, but have really good practices. I think in my experience, it's been what it comes down to is that if the farmer or the purveyor can really speak clearly and transparently about what they do, then it's probably a lot safer than if they can't. It's concerning when they can't, even with products that different products have called, let's say, the customer service number for patients. And if they hedge around certain questions, I know that probably isn't a product that I'm going to recommend or have someone use. If they can speak better, more clearly about it too, then I would say that's definitely encouraging. I think non-GMO in general, it's a concerning idea if things are being genetically modified and engineered. That was a huge concern with soy at one point. So, are we moving away from that? That's why I think especially like we recommend when it comes to soy, non-organic and GMO, organic and non-GMO is typically the better way to go. But I don't know. I mean, there's always that sort of relative answer to things.
And I always just like to make the point that organic foods are more expensive. So I think it's just, if we kind of weigh things a little bit, at the end of the day, it's what's affordable and can keep you on the path of making the healthiest food choices. And just on a side note, there's no strong research relative to conventional foods and organic saying organic, kind of is better. So again, I think going to resources, I know there's something with regards to, fruits and vegetables called the Dirty Dozen that you can refer to if you're looking to purchase organic foods, which gives you a list of, the safest things to purchase if they are not organic versus a list of the things that are organic, which would be something to focus on.
Right.
And I think too, like purchasing locally is helpful to kind of see, again, when farmers can speak transparently about it, but even seeing the quality, sometimes the quality of a fruit or vegetable is, again, like that deeper, darker color and texture. And that indicates that maybe a higher phytochemical content that would be more protective. When I have read something once, when fruits and vegetables have to withstand conditions without all of those conventional pesticides, and they become stronger within, they're actually, a higher quality in and of themselves. So again, but I think, does it always have to be organic? No, not necessarily, because sometimes it can be, the pricing can be really expensive.
You. The next question is, some of my medications are causing elevated liver enzymes. What foods can you recommend that are friendly to help heal the liver?
Unfortunately, I don't know that there's so much that you can really do with your diet. I think honestly, one of the major things obviously would be your alcohol intake and maybe your fat, intake. But I don't necessarily know that there's going to be a single food or, significant diet modification that you can make that will have real impact. I don't know how you feel about that, Gina, or.
So I think, I don't know. I mean, I have a lot of patients that have seemed to enjoy bone broth, whether it's the taste, sometimes if it's just the warm comfort of it, but is it higher in minerals and nutrients? Possibly. Again, I think it's all where it is sourced from or comes from. What I would just say in terms of vegetarian, vegetarian broth or stock, making your own stock maybe from, and again, that kind of loops in sustainability of utilizing different components of your fruits and vegetables to make a really nutrient-rich stock. There's a lot of cancer nutrition cookbooks that we found along the way that have recipes for that. So that might be a good place to start.
Yeah, I mean, the benefit obviously being some of the electrolytes and nutrients, which you can definitely parallel with the fruits and vegetables that you're choosing to put on your plate on the day to day. So I think there's always ways to be creative and still really reap the full nutritional benefit that you find in, kind of, certain products, which you don't necessarily want to purchase or consume. Well, I mean, I think the current recommendation is not exceeding 2,300 milligrams per day. I think everybody is different. If you have a history of high blood pressure, obviously that would definitely be varied a little bit. Again, as we mentioned, added salt is a pro-inflammatory food, which definitely has an impact on our healthy healthy cells. So I think, really striving to increase or enhance flavors of recipes with alternate spices. I say go crazy with spices, and I spend an extra 5 to 10 minutes in that section of your supermarket just to see how creative you can be. I think that's definitely a healthier route to take.
I agree. And I think I love that idea about that area of the supermarket, because so many of those herbs and spices can also have such cancer protective effects and anti-inflammatory effects. So they're just so good overall. So it would be a good idea.